Hi, and welcome to the Rotator Cuff Expert YouTube channel. My name is Dr. Daniel Orcutt. In this channel, we talk about all things rotator cuff. The point of my creating this channel is to give education and knowledge and understanding about what it means to have a rotator cuff injury. There's lots and lots of questions from the very beginning to the very end. There's lots of unknowns, and so my job here is to try to educate you, to protect you, and to enable you to get through this surgery and this time of life as easy as possible. We know that rotator cuff surgery and surgeries on the shoulder are not easy, but my job is to try to make it as easy as possible for you. So if you have any questions, any thoughts, please leave them down below. Please subscribe to the channel, YouTube, Rotator Cuff Expert. Also, we have another website that we talk about, so a little bit of different things, as well as there's some products and things that you can help you get through your recovery, and that's at the website is myprotector.com. Anyway, thank you so much, and hope you enjoy the next video, and we will talk to you in just a minute. Hi family, welcome to another episode of Rotator Cuff Expert. This is the question actually we received from our Instagram page. The question about, well, what are the phases of post-op rehab? So physical therapy after rotator cuff repair. What are the phases? What are the kind of the general trends, what you might see? So the first thing is to know, obviously, it depends on the surgery. So talk with your surgeon. He's the one, she's the one who's gonna be able to tell you exactly what the timing is. Each surgeon may have a little bit of different timing, and depending exactly what you're having done in your shoulders would depend on how this timing looks as well. So this is a generalized understanding of what happens if you have a rotator cuff repair, what the timing is typically for recovery, and how things, different things play into that. So again, it's hard to say exactly. If you have something different than a rotator cuff repair, then it'll be different. But the general trends, and because there's so many people who have rotator cuff repairs, this is probably the dominant shoulder surgery that we do out there. So here is the general idea. So one, we have pre-op. So pre-op before surgery, obviously. So there's probably not a lot of late pre-op to do. The pre-op therapy that you did was to help you prevent a shoulder surgery. If you could not prevent the shoulder surgery, the therapy failed. And so there's not a lot to do right before the surgery. The only exception is if you're really stiff, we might ask you to try to keep that motion going, even if your rotator cuff is torn. Not necessarily active, right? Not lifting yourself, but using your other arm to help lift up. We may try to get that flexibility, because if you're stiff before surgery, it's hard not to be stiff after surgery. So we may have you do some general range of motion before surgery if you are stiff. So here's post-op day one. So typically post-op day 1 or 0 to the third post-op day, there's not a lot we're gonna expect you to do. Very little, actually. At post-op day 3, typically for me, 2 or 3 is when we take the bandages off, take the big dressing off. It may be different, again, depending on where you are in the world, in the country. But generally, we're gonna do something. You're gonna be able to take the dressing off. You'll see the little incision, the little poke holes. Take the dressing off, and then you may start some gentle range of motion. And usually, in my situation, we'll give somebody a sheet to say, here's what you do in the very beginning. And so we won't see them until about post-op day 14, 10 to 14, we'll see them in the office. So we have from post-op day 0 to 3, not much. From 3 to 14, a little bit, but still not much. We still don't want people to lift their arm up because that can stress the repair. So we don't want a lot then. Again, this is typically for me, and this is for a standard run-of-the-mill rotator cuff repair. People who are really stiff or people who have a huge rotator cuff tear would change some of this recovery, okay? So 0 to 3, not much. 3 to 14, a little bit. 14, what we say, so immediate post, soon post, mid post. So from 14 to 42 days. So somewhere between 2 weeks and 6 weeks, we're gonna do some therapy, typically 2 days a week. Some people have more than 2 days a week. Some people have less than 2 days a week, but general 2 days a week, going to the therapist, and they're gonna help you get that motion back. They're gonna do that passive stuff for you. Again, they don't want you to lift it up, but they're gonna do some passive stuff for you so you get some of that motion back. We're trying not to stress the repair, because we don't wanna stress the repair at least until 6 weeks. There's some data that says it takes about 3 months for the rotator cuff to really heal, but probably at 6 weeks, it gives us enough time that we can start some more active stuff. So again, not much, a little, passive motion stretching stuff until about 42 days, till about 6 weeks after surgery. At 6 weeks after surgery, then we're gonna start the active stuff. We're gonna try and get that rotator cuff strong again. Between 6 weeks and 3 months is really the bulk of the work of recovery, bulk of the work of strengthening that shoulder. So we go 6 weeks to 3 months, usually again, a couple times a week. We'll do that. Hopefully the focus then will be more on strengthening of the shoulder and less on range of motion. Occasionally we still have to work on the range of motion because you still may have some stiffness, but we're gonna try to minimize the focus on stretching and maximize the focus on strengthening. So that's from 6 weeks until 3 months. After 3 months, typically people are relatively done with formal physical therapy. Typically we'll have them transition to a home exercise program, which will last probably forever. Just like an exercise program for us, for our heart, lungs, whatever, it should last forever. The rotator cuff, the shoulder, should probably last forever as well. But we expect 365, right here, 1 year after surgery is where we think we're gonna have it to the maximum, meaning there's a term in medicine called maximal medical improvement, or MMI. We use this a lot in workers' comp and other cases, but it's true for everything. So when do you think you're going to be as best as you can possibly be? And that's probably day 365. The key thing is, right, from day 3 to day 14, we may not see a lot of improvement. From day 14 to 42, we should see a lot of range of motion improvement. From day 42 to day, whatever it is, 3 months, 12 weeks down the road, we should see a lot of strength improvement. After that 3 month mark, we may not see a ton of improvement. You know, we'll flatten the improvement. Let's say that we have lots of improvement like this, and then for the rest of the year, it kind of flattens off and you slowly get some improvement over time, but not a lot of improvement. So the key improvement dates are really 2 weeks to 6 weeks, 6 weeks to 3 months. That's where the vast majority of your recovery is going to be. After that, you should continue to get better. You know, start to train for more sport-specific things like golf or tennis or whatever, or more work-related things, lifting things overhead. But so that's what we expect. So again, in short, first couple days, not much. First couple weeks, a little bit. Between a couple weeks and 6 weeks, we work on that flexibility. From 6 weeks to 3 months, we work on that strength. And then after that, you do it on your own. You keep on with your exercise. This is the general idea of post-op time frame, therapy, range of motion after a rotator cuff repair. Again, if you are having something other than a rotator cuff repair, if you're having a slap repair, or you're having a biceps repair, that's going to be different, and there's going to be different parameters of what you should and shouldn't be doing during that time frame. So hope this helps. If you like the channel, please subscribe. If you have any questions, comments, any thoughts, anything that you would like us to talk about on the Rotator Cuff Expert, please leave those below. Appreciate your help, appreciate your feedback, and we'll see you soon.